Now, one of the things I think that will turn some people off about fasting is they're like, well, I'm on this exercise program, or I'm training for this 5K, and I need that goo, I need that, that stuff. Um,
Mhm.
can you talk a little bit about exercising during intuitive fasting?
Sure. So I talk about this at length in the book because that's a common question. So we all come in at this point of trying a tool like this at different points of our health journey. We all have different levels of metabolic inflexibility or metabolic rigidity. And it's one of the reasons why I started the book out with a quiz. And the quiz is adapted from questions that I ask patients. And I wanted people to kind of get a subjective metric for them to see more or less like how is their metabolic flexibility. So if someone's severely or significantly metabolically inflexible, they may want to take it easier at the start, right? And not work out as much whenever they're learning. Their body's learning to burn fat for fuel, and their body's being trained to be become more flexible. Now, keep in mind the specific subset of intermittent fasting that I'm exploring with in intuitive fasting is not caloric restriction. So it's time compressed feeding or time restricted feeding. You're getting all the calories that you need just in specific windows. So for most of these lighter to moderate flexible intermittent fasting windows, it's actually not that difficult to work out. Week 3 in the protocol probably be the one that people have to make a personal decision on that. Some people will still be fine, but you still have it's an almost OMAD week in week 3, but it's non-consecutive. So meaning you're doing it every other day, not every day. And OMAD is an acronym that stands for one meal a day, but it's almost OMAD because I referenced some studies in there, but basically making it a little bit more flexible to give you more windows to eat and not trying to get all your calories in a 1 hour window, which is the more traditional OMAD 23-1 fasting to eating window. So an almost OMAD approach is a little bit more flexible. So you could work out within that 2 to 4 hour window if you wanted to not be doing a fasted workout. But regardless, that's the deepest fast that's there. So I'm not doing any multiple day long fast, which is a bit of a different thing. I think one of the reasons why this type of intermittent fasting that I'm exploring in the book is so accessible is because people can live their lives. They don't have to make an overhaul of everything in their life or feel like they can't live and engage with activities like exercise. They can still do it. It may take some planning and may take some leaning in at the beginning. But I go into detail in the book, but my basic advice is if you have a certain level of activity level that you're used to, still do it. You don't have to stop doing that. But I wouldn't start, CrossFit and intermittent fasting at the same time either.